Let's talk about choroid plexus papilloma, which are considered benign lesions of grade 1. Neuroepithelial intraventricular tumors, of course, they are intraventricular because they come from the choroid plexus. Choroid plexus is the, let's call it, specialized ependymal cells in the ventricles of the brain that secretes the CSF. So choroid plexus papilloma come from this, so they must be in the ventricles. And it's more common in pediatric population, but it can also occur in the adults. Adults are more commonly seen those tumors in the fourth ventricle, and in the lateral ventricle is the pediatric population. It's a solid vascular tumor, and it's a cauliflower lesions that enhances vividly. So you can see in T1, when you give gadolinium, okay, this is contrast CT with gadolinium. You can see at the area of the lateral ventricle, you see this cauliflower lesion that, of course, enhances. You can see right over here with edema surrounding it, T1 with contrast. Of course, they can cause hydrocephalus. You can see how common is it, the hydrocephalus. Hydrocephalus is very common, seen in over 80% of cases. It's just combinations of CSF overproduction because it comes from the choroid plexus, yeah, and choroid plexus secretes CSF, and if you have a tumor there, this tumor from those cells can also may secrete CSF, and also it may damage the arachnoid granulation resorption of CSF. So those two mechanisms can cause this. Okay, so adults most common in the fourth ventricle, and the children most common in the lateral ventricle, in the trigone. And the treatment, as you can imagine, total excision should be the aim of treatment, and curative in majority of cases. So this is the treatment. This is, again, vividly enhanced cauliflower lesion in the lateral ventricle in pediatrics, and in the fourth ventricle in adults. There may be some surrounding edema, as you can see when it's big, and you can see here the very massive hydrocephalus that it causes. Again, here in the fourth ventricle, so it's probably an adult. This is lateral ventricle in the trigone, probably a pediatric patient. And this is it, vividly enhancing, as we said. So this was about choroid plexus papilloma, which is grade 1. There are higher grade of choroid plexus tumors like atypical and carcinoma, but we didn't talk about this. This was choroid plexus papilloma, and that's it. Thank you.